We live in a society that doesn't take mental health issues seriously. Some people hide and tell themselves to stop worrying. Other people have been dismissed before and think that looking for help won't do them any good. Most of the time, people don't look for treatment because of the stigma and whether it will affect jobs or relationships. But mental health disorders like severe anxiety are health issues, just like diabetes or high cholesterol. An anxiety disorder needs to be treated with the same urgency as a physical illness. Nearly 40 million people suffer from an anxiety disorder in the US. Even if it's the most common mental illness in the United States, there are still many misconceptions. One big cause of confusion is the difference between suffering from an anxiety disorder and just having normal anxiety. Anxiety is a normal emotion that many of us feel in our everyday lives. It's just a way to warn us about danger or threat. Stress from work, a test in school, or even moving to a different city might trigger anxiousness. This type of anxiety is related to simple, solvable fears. But sometimes anxiety can become too overwhelming and unmanageable, and that's when it starts to become a problem. Normally, it works like this. When placed in a stressful situation, anxiety starts in the brain's amygdala, which then alerts other parts of the brain to prepare for defensive action. Next, the hypothalamus transfers this signal to other parts of the body. This causes our muscles to tense up, our heart rate to increase, and our breathing to become more heavier. This is called the fight or flight response. To keep this reaction in check, there are many threat detection systems in our brain. For example, when the amygdala notices a problem, the ventromedial prefrontal cortex communicates to the amygdala, giving feedback about the situation and helping the body calm down. But with an anxiety disorder, these mechanisms that reduce panic function incorrectly, causing excessive worry. Because of this, people with an anxiety disorder experience persistent, recurring anxiety. These anxiety disorders include generalized anxiety disorder, panic disorder, social anxiety disorder, and many other phobias. Luckily, anxiety disorders can be treated, and it's important to seek help. If the anxiety disorder is severe, then medication can give short-term and long-term relief. Some other forms of therapy can help too, such as cognitive behavior therapy and acceptance and commitment therapy. These treatments help maintain self-confidence and control and develops coping strategies. It's important to understand different mental illnesses and their true impact before assuming their effects without actually experiencing them. And remember, mental illnesses are just as real as physical illnesses.